The most sophisticated lie? That is a really good question. The government is here to save you. That they were doing something for our own benefit, and they weren't. They were doing something for their own benefit. Yeah. The least sophisticated was probably that mRNA or COVID-19 vaccines were safe and effective, because it quite clearly turned out very quickly that they weren't either safe or effective.
Safe and effective.
Sikkert og effektivt.
The most sophisticated lie. I think also, yes. I mean, I just played today a clip of the executive director, Emma Cook, of the European Medicines Agency. And this is the story they have told everyone, that the vaccine stays in the injection site, and the material like the mRNA and the vaccinal spike proteins degrade quickly. But the documentation that I've gone through and looked at, that's been available for a long time. Since early January 2021, the Australian drug regulators highlighted a study done on rats with the bioaccumulation of the lipid nanoparticles. It goes to every tissue of the every organ. So this was information that was available back then. So for Emma Cook to just recently, this is March 27th in the European Parliament, to spread that level of misinformation is a crime, really, and they need to be held accountable.
Sen när media då sätter de här epiteten då att man ska vara vaccinförnekare eller någonting sånt. Jag menar, jag som alla andra har väl tagit alla vacciner som man har rekommenderat. Så jag tycker det är otroligt viktigt med vacciner. Men det här är någonting annat, och vi har inte haft mRNA-vacciner tidigare. Och det tackar 17 för att man måste förstå vad det handlar om. Och inte minst när man sitter i riksdagen. För det är många människor som är väldigt oroliga idag, och då man måste ta deras oro på största allvar.
I'm worried because WHO undertakes it to deprive the member states of their control on their core interests and sovereign constitutional duties that they have to perform, and their obligations to protect the population on the one side, and on the other side, because of the situation we will face as citizens, we will lose or we will have no protection anymore with respect to our human rights and basic things like the self-determination, whether we want or not to want, be subject to a medical treatment, to what medical treatment we want to be subject, but even more far-reaching consequences we will have to face when it comes down to extended lockdowns, extended periods of emergency law, which means that the basic rules will not be determined by our own local governments, but will be determined by WHO. So all this results in a wide loss of control of our personal lives, and loss of control as well from the perspective of our states. They are literally losing control of their own affairs, and this is why we have to stop this entire process.
Du kan si i det firmaet jeg jobbet i, så jobbet vi med at en ny medisin skulle treffe det spesifikke organet det skulle fungere i. Og det er en utfordring. For kroppen vil jo ikke ha noen nye medikamenter inn i blodbanen, så kroppen gjør veldig, veldig mye motstand. Nummer 2 så er det jo at hvis du når frem til det organet eller cella det skal være, så skal medisin inn i cella. Og da snakker vi om nye typer medisiner som er med svære molekyler. Og så selv om det heter nanopartikkel, så er den ganske stor i forhold til et molekyl. Så skal den inn i cella, og så skal den utøve sin funksjon uten å ha bivirkninger. Men det som er med de her lipide nanopartiklene, for eksempel, i tillegg til mRNA, som liksom er den delen av de svære molekyler som skal utføre jobben, så er det jo masse andre molekyler. Noen av dem er jo giftige, noen brytes ikke ned. De er jo også inne i cella. Det snakkes det veldig, veldig lite om hva som skjer med de molekylene. Ingen vet. Ingen ser ut til å gidde å bry seg heller. Og det er bekymringsfullt.
I've spent a lot of time going through all the documentation pretty much that the regulators relied on to grant emergency use authorization of the Pfizer-BioNTech mRNA vaccine, and come across many shocking, anomalies and also cases of fabricated data, falsification. I've also interviewed whistleblowers like Brooke Jackson. She was a Pfizer/Fentavia whistleblower. And basically what she said, the sort of level of malfeasance and how you just can't rely on the data, I found as well. And also it's been astounding how the regulators have just solely relied on this information that they get from the pharmaceutical companies, and they haven't done any sort of verification. And as you dig deeper into it, you find there's cases of fraud, and that has major ramifications. And also just the alarming, the harms of the vaccine. And looking through the EU's safety reports, which is an important pharmacovigilance document, even though it's crammed with damning data. I looked at the first 6 months when they rolled out the vaccine, and it's horrific data, yet they conclude that the benefit risk safety profile remains favorable.
En ting som har bekymret meg med vitenskapen de siste årene, det er jo at det er jo andre enn meg. Det er jo redaktøren i både Lancet og New England Journal of Medicine. De sier jo rett ut at medisinsk forskning er mer eller mindre kjøpt av den farmasøytiske industrien. Du kan ikke stole på de resultatene du får derifra.
Recently, Kevin McKernan's findings that there is high level of DNA contamination, probably in Moderna and Pfizer's mRNA products, means that the DNA is there that could actually integrate into sperm or egg. And that's a real worry, because these products were treated as vaccines. That means they were never considered as gene therapy products, which a normal mRNA product would be. But because they're classified as a vaccine against an infectious agent, then they're treated as a normal vaccine. So none of the tests were done on genotoxicity. So the simple answer is nobody has a clue, because it was never checked. One thing that worries me is how quickly governments have tried to use the pandemic to try and introduce new legislation, which normally would never have got through Parliament. But since there was nobody in Parliament and nobody needed to decide, or very few people to debate, then certain policies and regulations were put through that were, in the UK at least, that were horrendous.
Alltså i Sverige så pratar vi inte om någonting egentligen överhuvudtaget, utan där ska vi bara lyssna på rekommendationerna från Folkhälsomyndigheten. Och då är det ju inte så lätt att få ihop logiken, alltså bara baserat egentligen på Pfizers egna data som visar tydligt deras djurstudier som gjordes. När man tittar på dem, till exempel då, så visar de ju tydligt att liponanopartiklarna som då innehåller mRNA och som då i cellen producerar spikproteiner, att de går till äggstockarna till exempel och till levern. Och då vill man ju förstå när sen då barnafödandet går ner kraftigt. Behöver absolut inte ha någon koppling, men man vill förstå lite mer kring det här, tycker jag.
Lipide nanopartikler, det er en partikkel som er designet slik at du skal kunne putte en medisin inni nanopartikkelen. Midt inni der så kunne du ha masse medisiner som gjør at du kan liksom få en større dose inn i cellene. Hvis du bare har dem, i hvert fall i tilfelle med mRNA, hvis du ikke putter det i nanopartikkelen, men injiserer det rett i blodet, så blir det fjernet umiddelbart og brutt ned. Så det må inn i en sånn beskyttelseskappe da, for at det skal kunne overleve i blodsirkulasjonen. De har jo funnet ut at de finner det i kroppen, jeg husker ikke antall dager, ca. 50 dager. Men det var da de sluttet. Hvis de hadde sjekket til 60 dager, 70 dager, så kanskje de hadde funnet det da også. Så det er ikke sånn som det vi får høre, at det blir fort och effektivt borte. Bara lögn.
Som sagt, bara för att media är väldigt, väldigt dåligt insatta och ointresserade av naturvetenskap och vill följa någon form av agenda, så kan vi faktiskt inte ta någon hänsyn till det. Så att jag tror att kan jag bidra till att det blir någon form av debatt där vi kan prata om de här sakerna på ett vuxet sätt, så tar jag gärna några smällar. För frågan är alldeles för viktig och vi måste börja ställa frågor och det är vårt ansvar.
I like to think that as more the truth comes out and more scandals and I don't know, malfeasance, comes out of all of this, that there's lawyers that will take up the case and try and hold, these people who are supposed to protect and promote public health and hold them accountable. And of course the pharmaceutical companies, safe and effective. The mantra and that was said across all platforms, that the vaccine was safe and effective. You had politicians saying it, trying to convince the public, the regulators saying it, obviously the pharmaceutical companies coming out and saying no risk of any vaccine-related harms, it's safe and effective. And I found that both of those, safe and effective, are completely false. This mRNA-based injection is neither safe and neither effective. I think there needs to be a dismantling of the way that the regulators operate, because they are solely funded, majority, like 85% of funding comes from the very industry that they're supposed to regulate. So there is, I've said this before, there is no way you can have them sort of regulating an industry that they're being, they're relying on that for their income. So it's, the fox, you've got the fox guarding the hen house, and they have completely, there's been a dereliction of duty in their role as drug regulators. They have failed the public, and there needs to be a complete change in how they are run.
Vi begynner å se igjen noe av det terrenget som var i oppspillet til både første og andre verdenskrig. Og det kan vel det. Ok.
Hva gjør dere? Ingenting. Det er der vi skal være.